Okay, sorry about that. We ran out of time on that last one, so this is going to be part 2 of the suture video. Okay, as you see, we've already pressed the needle through, and once again, this video is for entertainment purposes only. This is just to show you how to suture a wound. This is not telling you to do it. I don't condone you doing it. This is working on the worst case possible scenario that you are stranded in the middle of the wilderness. You have a suture kit with you, and you have no way of getting to medical. Okay? Back to this video here. What we're doing now, we've shown you the first suture, which was done with an actual suture needle. Now what I'm going to do is show you how to do it again, just to recap. But this time I'm going to use a needle and thread, regular needle and thread, so that you can see how the knot is done. Okay, the other one was a little bit hard to see, so I'm doing this to show you how it's actually done. So we're going to pretend that this is an actual deal again, okay? What you're going to do is you're going to, after you've gone through your wound, you're going to take and put your hemostats in the middle of the wound. You're not touching anything, you're just putting it in the middle of the wound. This is strictly a guide. You're going to take your string that's attached to your suture, and you're going to wrap it around the hemostats twice, just like you see. You're going to then grab the end, the free end of the suture that's hanging out, and you're going to pull it tight. Just tight enough to close the wound. The two edges of the skin touching. You don't want to pull it too tight. That'll cause bad scarring. Okay? Just tight enough that both edges of the skin are touching. Now, you're going to take and put your hemostats back in the wound again, over the wound. You're going to wrap the line around the hemostats one time this time, and you're going to pull it back through again. Okay? One more time going back the other direction. Put the hemostats in the wound. You're going to put the line around the hemostat. You're going to grab it one more final time to lock it in place. Okay? I like to put a few more in just to make sure. It's better to cover it so you don't have that problem of having it come undone. Once you have it done, you snip it off, give it a good sterile dressing, make sure it stays clean. Once the sutures are in, don't take them out and try to replace them, leave them in. Best thing I can do for you is to tell you to do your research, do your homework online. Try to find out, because there's going to be different opinions, try to find out how long you should leave the suture in for. Me personally, I won't get into what I would personally do. My way is a little bit different than what you may find, and I want to make sure that I'm not giving you too much information. I'm just trying to show you how to properly suture a wound. So one more time, I'm going to do this with the carpet thread and a regular needle, just to show you. Okay, it's not how it would be. The first video showed you actually how to put the suture in. So I'm just going to pull it through, and I'm just showing you how to do the knot. Okay? It's kind of hard to do on a table, sorry about this. Okay? Just like I showed before, you're going to take the thread after it's gone through. And remember I told you about dividing. So it was half the wound, first stitch, half the wound for the second stitch. Everything is done in halves. Don't start at one end and work your way over. You're going to have a bad stitch and your corners may not line up properly. Okay? So once again, you're going to put the thread here. You're going to wrap it around twice on the first time. You're going to grab the end, pull it through, pull it just tight enough to close the edges of the skin. The edges of the skin should be touching. That's perfect. You're going to lay your hemostat over the middle of the wound again. You're going to come back one loop, grab the end, pull it through. You're going to do it one more time to actually lock the stitch. Okay? As I said, I usually will go 4 to 5 times because I always want to make sure that it doesn't come apart. Okay? Once you're done, Again, clip the ends, and there you go. Hopefully this has been a little bit informative for you. Like I said, once again, this was for entertainment purposes only. Do not go out and try to play doctor. There's a reason why they get paid the big bucks. And if I got cut, I can tell you right now, if I have any possible way of getting to the hospital, I will. There are a lot of things that can go wrong with infections and everything else. It's better to have a doctor actually do this than yourself. Okay? Once again, this is Doc. This is part of our Train to Survive video series. This is going to be part 2 of the 2-part How to Suture a Wound. Thank you very much for watching. Leave your comments. I'm curious to see what your comments are on this. Anyone who has any kind of medical training, let me know what you think. And other than that, don't forget to subscribe. And you have a great day.